So I think of glaucoma as a group of diseases that damage the part of the eye called the optic nerve. If a person's eye pressure is higher than their particular optic nerve can tolerate, the optic nerve gradually gets damaged that we can see and measure in our office, and it results in loss of peripheral vision, which we can also see and measure in the office.
We're very careful about glaucoma because when people initially develop glaucoma, they don't have any symptoms. And when they develop damage from glaucoma, we have no way of reversing that damage. So there's two main categories of glaucoma. There's open angle, which is the most common type, and then there's something called narrow angle. We worry about these angles because it leads up to the drain on the inside of the eye. The eye is continuously making fluid and draining fluid. If there's something abnormal with the drain or the angle leading up to the drain is narrow, you're at risk for the pressure building up.
The most common risk factor that people have heard about for glaucoma is increased eye pressure. So we measure that at the time of the eye exam. But also there's other risks. Glaucoma tends to run in families. So if you have a mother or father, brother or sister with glaucoma, you probably have a higher risk to get glaucoma than an average person. There's also things we see on the eye exam, such as a thin cornea is a risk factor for glaucoma. The front of the eye has a drain, and it's shaped differently in different people. And when we see that, what we call a narrow anterior chamber angle, that's sometimes a risk factor for glaucoma.
There's multiple tests we do in the office to diagnose glaucoma, and eye pressure is one of the major ones. High eye pressure is a risk factor for glaucoma. However, not everybody with glaucoma has high eye pressure.
We also measure at least once in the patient's life, the thickness of the cornea. Approximately once a year, we measure the shape of the drain in the front of the eye. Probably most importantly, we evaluate the person's optic nerve. Because it's the optic nerve that gets glaucoma this time.
So there are multiple tests that I like to use at least once a year to measure glaucoma. One of those is visual field testing. When you come in for a visual field test, we test one eye at a time. You're looking at a central target, and we shine lights in your peripheral vision. You click a button like a video game when you see the light. It helps us measure if there are any glaucoma defects in your peripheral vision. And glaucoma tends to affect the peripheral vision before it affects the central vision. Another one of the tests that I like to do once a year in patients with glaucoma or who we're evaluating for glaucoma is an OCT, or ocular coherence tomography test of their optic nerve. It measures the nerve fibers entering the optic nerve, and we're looking for areas of thinning of the nerve fibers in a pattern consistent with glaucoma. We do that test about once a year, looking for any progression. Our goal with proper treatment of glaucoma is that test looks stable or the same year to year.
So if a person is diagnosed with the most common kind of glaucoma, which is called open angle glaucoma, there's two initial types of treatments. All the treatments are based on trying to reduce a person's intraocular pressure. The lower the pressure in the eye, the less likely the glaucoma gets worse over time. So the two initial treatments could be eye drops to lower the pressure versus a laser. The current laser we use is called a selective laser trabeculoplasty. Both treatments have a good shot at lowering the eye pressure.
So for narrow angle glaucoma, if you're in acute narrow angle glaucoma attack and your pressure is high, we may do a procedure called a laser iridotomy, where we do a small laser procedure on the iris, the colored part of the eye, to give fluid another route to get to the drain on the inside of the eye. In patients who have narrow angles but currently do not have glaucoma damage, some of them are at high risk for that drain to close off. In those patients, we do the same laser procedure as a preventative measure so they don't end up in a narrow angle attack.
If the laser lowers the eye pressure at the 4 to 6 week visit, then we watch people without drops the same way we would if they were taking drops. So basically we'll have the patient come back at 3 months, make sure the pressure stays the same, then we have them come back at 6 months. As long as the pressure stays low, then we watch the patient every 6 months with a pressure check and measure their peripheral vision, test once a year, and take a picture of their optic nerve once a year.
Go.
The interesting thing about glaucoma is that the most common kind of glaucoma, open-angle glaucoma, has no symptoms. We frequently find it by accident on an eye exam. Because it has no symptoms, people can have glaucomatous damage without knowing, and the damage from glaucoma is irreversible. The key then is to have occasional eye exams to look for glaucoma so we can find it and start the treatment early.